I'll normally do a urine 24-hour looking at heavy metals in order to determine if zoster's around, you'd expect to see at least some increase in arsenic, right? If herpes simplex 1 is around, you'd normally expect to see a little bit of an elevation in things like mercury and cadmium, right? For a lot of the Lyme co-infections, you're normally going to see that increase in manganese and zinc. And so just know it's not just the fact that you got to learn every one of these infections, it's that you can kind of put the pieces together. Again, I don't want to make this feel so difficult that it feels unapproachable. I don't think you have to have all of that from the very beginning, but I do think if when you are looking to interpret some of your labs and prioritize your infection, so your first group, from my standpoint, is always going to be your primaries, that's going to be Lyme. How you prioritize afterwards may be a function of running other tests and getting a better understanding of what you want to actually prioritize, who's replicating, right? High iron, I mean, herpetics can't move without a bunch of iron, right? The other thing as far as toxins, just know there are certain toxins that are becoming ubiquitous at this point. We were talking last night about fluorinated compounds and the role of fluorinated compounds, perfluorates, to really damage an immune system. And so if you have folks that have an environment filled with a lot of toxins, it's going to be hard to stabilize them because those toxins are going to continue to damage or disable the immune system, allowing these opportunistic infections to come up. So I'll always talk to the people that I'm working with about getting their environment under control.